All right. All right. And three. Action.
All right, so I'm headed into the hospital here. I'm waiting in the ER to be seen.
Alright, Michael,
Yes, that's me.
alright, come with me to your room.
All right.
Alright, so what brings you in here today?
Yeah, I'm having a lot of pain. I've had like diarrhea nonstop. I'm usually having it 15 times a day, which is not normal for me. I've been having pain like in my rectum. I've been having pain in the lower left part of my abdomen. I've also been like noticing I'm really fatigued and all. And I have probably has something to do with diarrhea so much and everything. And I've also been kind of noticing the blood in my stool, and I wouldn't have come to the ER if it had just been no blood because I would have just gone to my regular doctor. But when I noticed the blood, that's where I started freaking out, and that's why I'm here.
Okay. Can you tell me more about the stool? Did you notice any abnormal color?
Yeah, I noticed it's really like dark brown, almost like a black and all, and it's got a really, really bad odor to it. It's not something normal that I've ever experienced. So.
Okay, and did you experience any pain at all?
Yeah, I have pain in my lower left part of my abdomen, and I'm also experiencing after I diarrhea. It's like really painful in my rectum area where it's all coming out. So,
Okay, alright, that's good to know. Have you had a history of any GI complications in the past?
I've had diarrhea in the past and all, but I've never had anything severe. I've never noticed blood or anything before, so that's why I was kind of thrown through a loop. Like, what is this? So.
Okay. And what does your diet consist of?
Yeah, I'm a big, big fan of McDonald's and Taco Bell. They're my go-tos, and I also love to drink a lot of beer. Like I'm probably doing a six-pack a day. I love it.
Back then, alright, so one thing I want to ensure is that you're drinking plenty of water.
I mean, Bud Light's kind of water, so. But I guess I get where you're going. I don't drink enough water. I'll be honest, right there.
Yes. Beer once in a while is good, but water and hydration is good for the body.
Okay.
So what I want to do is I want to get some blood work on you and some vitals done. I'm going to have you do a stool culture
Okay.
for me as well. That way that we could examine the stool more thoroughly. I'm going to give you a stool cup, a hat, a tongue to pick up the specimen and put in the cup. Once you're done, you're going to close the cup, put it in a biohazard bag, and then give it to me, and I'll bring it to the lab, and we're going to see if there's anything wrong.
Right.
I'm going to listen to your bowel sounds and feel your abdomen just to make sure that there's no obstruction.
Okay.
So get my stethoscope. Okay.
Ah. Ah.
Alright, perfect. Alright, so I'm going to speak to the doctor, and then I'll be right back.
Okay. Sounds great.
Alright, thank you.
Hello, Nurse Reyes. How are you?
I'm good, Dr. Alex. So I just spoke with the patient. He reported that he's been having some GI complications. He's been having diarrhea nonstop for a few days now. He noticed that the color of his stool was brown to the point where it became more blackish.
Okay.
He noticed a very foul smell that was worse than what he's used to. There's blood present in his stool. He indicates that there is pain in both his abdomen and his rectum. He's had a history of GI complications before in the past, but nothing this severe.
Okay.
And talked to him about his diet. He mentioned that he eats McDonald's every single day, and he drinks six-pack beer throughout the week.
Okay. What are his latest vitals? I want to especially focus on his his blood pressure and his temperature.
His temperature was fine. It was 97.6. but his blood pressure was very low. It was 88/65.
Okay, let's get some. Let's get lactated ringers in him. Stat. I'll put that order in, and then let me know about the stool culture.
Alright. And I also felt his abdomen. He does have lower left quadrant pain.
Okay. All right.
And
Well, so it could be a couple things, but let's get that stool culture back, and for that blood pressure, let's make sure he doesn't go into shock.
okay. Alright, thank you.
Yep. Talk to you again soon.
Alright, talk to you soon. Alright, Michael, I just spoke to the doctor. He did tell me a few things that he wants done. So based on your lab results and vitals, he wants to ensure that you're getting hydration. So he ordered lactated ringers.
Okay. What are those?
The lactated ringers are pretty much to ensure that your body stays hydrated.
Okay.
You're not drinking enough water. You know that beer is liquid, but it's not the right amount of liquid you need in your body to sustain hydration. So that would help. And I want to talk about your diet because you indicated to me that you're eating McDonald's, which is not the right amount of protein and nutrition in your body to help pass the stool properly.
Okay.
So you want to ensure that you're getting proper protein, so chicken, beef, more protein in your body, so that way that it will help pass the stool better.
Okay, I mean, as long as I can still have some protein and all, but like have healthier proteins, I'm definitely like for that, to try that. I'm definitely here to, I want to feel better. So anything that you guys recommend, I'm definitely willing to give it a try at least once. So
yes, and I did get the results for your stool culture. There's no signs of any microbes. So I will speak to the doctor about that and see what he wants to do moving forward.
Okay.
Just to see what's wrong.
All right, sounds good.
All right, so I will go and speak to him, and I will be right back to give you some answers.
All right, sounds good.
All right. Hello again.
Hello, doctor. So I spoke with the patient. We have initiated the lactated ringers for hydration, and we spoke about his test results, spoke about his diet change, where he was very receptive of adding more protein into his diet.
Okay.
And his stool culture results came back, and there's no signs of any microbes.
Okay. So it's probably not an infection, which means that I suspect that it's inflammatory bowel disease, and based on it being in the left side, probably ulcerative colitis. I'll get him into GI, order a colonoscopy, so we can make sure to figure this out.
Okay, that sounds great.
Lovely. All right. Yay.
All right.